Good afternoon, everyone. And continuing with the series of lectures which are being conducted by the Medical Education Technology Division, Atal Bihari Vajpayee Institute of Medical Sciences and Dr. Ram Manohar Lohia Hospital, in the Basics of Research and Ethics webinar. Today, we are having a lecture on data collection and data cleaning, a very important topic. And to take this lecture, we have a very wonderful person, Dr. Sanjeet Panesar. He is an associate professor, Department of Community Medicine in Atal Bihari Vajpayee Institute of Medical Sciences. So, Dr. Sanjeet, he is also a member of the Institutional Review Board. I now request Dr. Sanjeet to kindly start the lecture. Dr. Sanjeet, I have already enabled the screen sharing. So you can share the screen and then you can start the lecture.
Thank you, sir. Today's lecture, as sir already introduced, is on data collection and data cleaning. Let's straight away go to the lecture. It's an important topic for all of us because we have to come across in research in one way or the other, either as a faculty or as a mentor or as a student. So we usually consider that data collection will be just done on Excel or some software, or we'll just collect the data regarding these all things when we design the protocol or the questionnaire. It is a crucial thing, data collection, because whatever has been collected, it affects the results, the analysis, and whatever interpretation you're going to make out of the data you have or the protocol you have submitted. So data collection is usually done keeping in consideration what are the objectives of the study, and accordingly it is simultaneously started once the clearance is there. So I'll be covering the topic under these broad headings: sources of data, then there are subtypes: new, routine, patient notes, secondary data, data collection forms, types, instruction, anonymity and confidentiality, piloting, form filling and coding, data quality, and lastly data cleaning. See, this lecture is not like a workshop wherein we show how data entry is to be done in a particular software. This is primarily to give you a sensitization about the guidance or the guidelines, what all has to be kept in mind while we are thinking of data collection or the means of data collection. Now, the sources of data, the four sources: new, routine, patient notes, and secondary data, each has a different advantage or a disadvantage. Coming on to new data, this is done when a study is specifically designed. Okay, usually while we are writing the protocol or we are trying to write a research project for the institute, the type of tool what we develop is all considering the new data because it has not been collected in the past. So there are few inherent advantages and disadvantages. The advantage is that we have a control over what is to be collected, and whatever we record in the data, that is the current information, latest information. The disadvantage is it has cost implication and the time to collect, process, and then analyze. And in case if there is some participant refusal or a subject is lost in the follow-up, so we have missing data. Now, the problem of missing data may arise time and again, and we'll see across in various type of data sources, we have this consistent problem of missing data. Then is the routine data. Routine data is that the data is being collected for some other purpose. There is some investigation which is going on in the hospital. There is a particular service which is being catered or which is being delivered in the hospital, and it is not necessarily directly related to research. However, our research partly takes into account the topic of interest, and part of the data is already done routinely. So we collect the data from that laboratory or that room of X-ray or ultrasound or particular department, and then we try to use that data for analysis. It has few advantages: that it is quick to obtain. Already it is computerized because it's a routine investigation. There is a proper format in which it is being collected. But Whether that format is useful to us or fully useful or partly useful, that we are unaware of. So it may be already processed or computerized. Usually it has a much lower cost than the cost implicated in a primary research data collection. The disadvantages is that it is a routine data. We have no control over whether the data collected can be increased or decreased as per our need. The data is collected in a specific format and that format is fixed. So the data availability, it is not under our control. Then missing data, in case if there is some data which in routine investigation was missed, we will see it like that only. We do not have a chance to fill that data. It is difficult. And we discussed the format already because it's a routine data. It may not be exactly the way we want to accept it. Next is patient notes. These are the handwritten file records of the patient. Usually we ask for a file of a particular disease from the medical record section or from a particular ward wherein the patients are currently being treated. And we try to interpret the file record as per our study. The advantage is it is relatively quick because there is already a record at hand and the cost implication is less. The disadvantage is again because it is a data which was already recorded. So we don't have a control over it. The missing records are missed. We may not be able to fill the missing gaps. And moreover, the most important, the third point of disadvantage is that these are handwritten notes. So it may be difficult to read if the writing is not legible or clear. It may be difficult for us to search the parameter what we are looking for. And there may be a format which may be missing or which may be different from our requirement. Coming on to secondary data. Now, secondary data are the data collected or recorded for some other research study and which are used by us. For example, there is a census data available. For example, there is a sample registration scheme or a civil registration data available. There is a death data available at the hospital, and we want to do some analysis on that data available. The advantage is it is relatively quick. It is already processed, so data checking or data cleaning is less required, and usually the cost is lesser. So the highest cost is with the primary data collection, new data. The disadvantage again, it is similar to the previous two, that we don't have a control over the data which is available. The missing data again may be difficult to fill, and the data may not be in the format in which it is required. Lastly, it may be out of date. For example, if we take the data of census 2011, right now it is the year 2021, it's a decade old data. So it may not actually represent the scenario what we are studying right now. Coming on to the next part, which is data collection. Now, data collection, as a clinician, you are busy in your schedules. As a paraclinician, you are busy in your labs. As a non-clinician, you are busy in your theories. Data collection is as important as deciding onto a protocol or deciding onto a result or interpretation of a result of a study. Each part is crucial. While data collection it becomes important because this is going to give you the nidus on which you are going to run all the analysis. So the way you collect that information, this becomes important. It forms the basis of the analytical softwares which you are going to use, how you're going to collect the data so that it can be used with the softwares. There are few prerequisites for the data collection form. The research question and research design are already settled, and it has been decided what data is to be collected. It is only then that a research tool is made and you start off with the collection. Now the use is, it is either a written or an electronic record. Some during the PG time mostly, or in the field, mostly in the previous times we were using hard copies, papers or sheets or a photocopy of the set of the study tool. Over the time, this has improvised to tabs wherein you have a drop down menu and you keep on ticking. So as per the convenience, as per the availability of resources, we may have paper or electronic form, and ultimately this is used so as to collect the data in the format which will be analyzed using a computer. or a computer-based software. When we talk about types, paper or electronic, in the paper form, there are few different guidelines set which is to be followed specific for it. For the electronic data capture, there is a specific set of guidelines. In the table, we can see that there are few guidelines for the paper form, few for the electronic data capture. There are few guidelines which are common for both. We'll be also looking at that. First of all, let's see for the paper, the performer which has to be made, the study tool which has been designed, it should be clear and easy to fill out. There should be adequate space for writing the numbers or the text. Sometimes a particular section may be colored differently so as to highlight that section or to make it more attractive. In the follow-up study, sometimes a different colored set of questionnaire is used so as it becomes easy to ascertain that it's a follow-up patient to track as well as to fill the record. It has to be kept in mind while designing the study tool that if it is a too long tool, the person may not, feel comfortable answering all. So what we do, we try to make it as short as possible, but it has to be kept in mind that all essential details pertinent to a study are there. So the question paper may need, the questionnaire tool needs a proof study again and again so that it should be very crisp, very concise, to the point, and covering the entire topic of interest on which the research is being done. Coming on to the electronic data capture, in this, whenever you make an entry on the tab, it becomes a new file. So you keep on editing the file and keep on adding the new files. Do not delete the previous files. There are various tools. Epidata is another tool. One tool is a Kobo toolbox. So you have different platforms wherein the online or a computer-based tab is used for data collection. So each time you enter some information, it is updated from the previous version which you were having. So you have to save it. Keep in mind, you do not delete the previous version. Each of the page in the electronic record can be missed in case if it doesn't has a UID tag. So you have to make sure that each of the form has a unique identification particular to that subject so that at the end they could be merged together. In case if there is some audit trail is done usually so as to improvise a clinical process in the hospital. Okay. So it has to be with the date and the file number. And again, we have to keep the record. We have to back up all the files. So keep in mind the master copy of the data in which the addition or the editing of the data is taking place. At times, we may use filters to jump to the questions of a particular interest or to omit the questions which are not applicable. In computer language, it is called as algorithm, which gives rise to a structured questionnaire. In case if the response is no, so all the questions which were for some aspect which had been answered yes, those questions will get omitted. So the time wastage is held, it is handled there. And there has to be a programmed in coding. In case of hard copy, we usually have the responses written in the code forms 1, 2, 3, and each of the following code has a label in front of it. For example, educational qualification, illiterate code 1, or up to primary code 2, middle is code 3, then higher secondary is code 4, and so on. In tabs, we have a programming in which while designing that tool, already the auto-generated code is there. So whatever answer is being ticked or the box is being touched upon, automatically the codes get generated and it goes into the backup software file wherein the data is being recorded. Now there are few instructions which are common to both the methods. Few of them we have covered partly, few of them are common. The ID number for each subject should be there for tracking purpose. There should be a record of the date on which date the form was filled. It is important more important in randomized control trials or the follow-up studies. There should be clear instructions which should be given to the person who's going to fill the questionnaire in the field, so that there is no ambiguity in filling the responses to the questions which are asked in the questionnaire tool. In larger studies, training of the field staff is to be done. It is important so that the information which you are having is correct. Then design should be that it should minimize the errors which are there. So most of the questions, instead of leaving them open-ended, which may be omitted by the person who is filling in the questionnaire, we have all the anticipated responses to that particular question and we make boxes. So whatever response is given, the person may accordingly take. We have to ensure that whatever response is being given, it is clearly recorded. For example, the example is if height is to be measured, it has to be measured in what units. The unit should be mentioned, whether it is to be measured in meters or whether it should be measured in centimeters. So accordingly, whatever question is there, in case if there is some set of data which needs a recording in the form of a particular unit, the SI system or a metric system or the imperial system or FPS system, whatever is being used, it has to be mentioned. The units should be mentioned. All the items which we are going to collect in the study tool, they should be numbered. The pages should be numbered. Preferably use boxes or lines appropriate to the anticipated response what you are going to get to that particular question. Moreover, while designing the tool, all the steps which are taken, they should be in the appropriate format. And we have to think about what way we are going to analyze this data, so that at the starting itself, the data is recorded in the manner that it will be useful while the time of analysis. For example, if mean value is to be calculated, then let's record the absolute age of the person. Mean value of age is to be, if we have to analyze the mean value of the age, then instead of putting the age bracket categories like 10 to 20 years or 20 to 30 years, let's put the appropriate age. What's the age in completed years as the absolute value, so that we are able to calculate the mean out of it. Then all the process, we should be having an organized filing system, so that in case if some record needs to be checked, we can go to a particular date, and if it is organized, it will be easy for us to find the correct. Coming on to the next part, when we are using a study tool for data collection, anonymity and confidentiality needs to be maintained. At the time of protocol itself, usually it is a prerequisite in the consent that the information regarding the identity of the person will stay confidential, because it's primarily for research purpose. There may be some diseases which are being taken into consideration for research, which may have associated social stigma with them. So it becomes more so important in them. So instead of name as an identifier, use a UID number, unique ID number, or a hospital registration number, and the backup file for it in the form of unique ID number or the codes and the name of the person. That should be stored separately and securely. Even if the study is to be done anonymously, still a tracking ID has to be there, because in case if there is some query, then we may be able to follow up with the original form and correct it. Then is piloting. We often talk about that whatever study tool is being used, it has to be piloted. So what is piloting? What is its use? Piloting is done to test the data collection process, how in variable circumstances it's gonna practically get easy for or difficult for the person who is collecting the data. So usually we take smaller sample, approximately 10% of the actual study sample is taken. It may or may not be the disease of interest. It may or may not be the same place where you are going to conduct the original study. It can be done anywhere. So you take that smaller sample and you try to subject them to the questions which are in their study tool, so as to get all the possible responses. And whatever responses you get, you simply check or you write the text. It helps us to ensure that what are the problems we face while introducing the study tool, and in case if there is a problem, we may be able to resolve it prior to the main data collection. Moreover, it also helps us to identify how much time is being taken for that performer, if it needs to be lengthened or shortened, or whether the topic is fully covered or not. Are these questions sufficient enough to cover the topic of interest about which the research is being done or some modification is needed. So that's the role of piloting. It helps us to ensure the form then accommodate all the responses which are possible, or simply check if there is enough free space for the text answer. So if we keep in mind all these points, we understand that the importance of piloting is crucial. Coming to the form filling, whosoever person is using the tool to be filled, whether it is the beneficiary, whether it is the patient or the case of interest, or whether it is some other person who's going to subject the case of interest to a schedule, to a questionnaire schedule. So there should be always instructions to about how to fill the response. And the detail of the instruction or the complexity of instruction will depend on the level of experience the person is filling the form. For example, if a medical person, a doctor is filling the form, we may give detailed instruction. In case if it is a paraclinical, then it has to be in the language so that the paraclinical can understand. It has to be very crisp, small instruction. If it is a layman, we have to tell the instruction in his own local language and try not to complicate it too much. Try to keep it as simple as possible. इन सवालों का जवाब आप हाँ या ना में दे सकते हैं, या आपके दर्द का आप 1 से 10 के नंबरों के अंदर बता सकते हैं कि कितना आपका पेन है. Then in case if we are doing an extensive study, if the multiple people are gonna be the part of the study, or multiple people are gonna use the interview schedule to ask the questions, then we need to train them so that everybody is at the same page. In case if we are using handwritten notes, then they have to know that what part of the information is the one which we need to record. So there are some items which need to be considered while using the study tool, that the writing has to be very clear, preferably use a pen instead of a pencil. If there is a mistake, don't overwrite on it. It causes confusion. You omit it and rewrite it correctly. Or you can use a correction fluid if the space is not there. If it's a hard copy, then you can write. If it's a tab, you can backspace, erase it, and then write. There has to be examples so as to show them how the form is to be filled. Sometimes people guess the data just by looking at the person that this might be his weight. Or in case if the record was already taken, then they forgot to fill the gender. Then according to the name, supposedly name Kamal came, the beneficiary whose interview was taken, his name was Kamal. So the person guesses that Kamal could be a female name, so he writes female, whereas Kamal could be a male name. So there may be a doubt. So guessing should be discouraged. No guessing has to be done. And calculations, try to keep the study tool information receiving. Calculation, leave the calculations for the analysis part. So the person should just receive the information and he should just mention the information. If the person keeps on calculating there, that will lead to error. The topic of coding, it is important for us to understand what coding is in the form of research study tools. The relevance of coding is that it helps us to enter the non-numerical as well as numerical data to be used in statistical analysis with a computer. Now, coding will assign a specific unique number to each of the possible response, which we are going to get in each of the study questionnaire tool or the questionnaire schedule. The need is that a particular category is assigned a particular number. It is important that while we are doing the analysis, the computer analyzes everything using the codes. However, the results which are available in the form of codes at the end of analysis, we need to add appropriate label for each of the code. For example, code 1, 2, 3 is for BMI measurement, wherein 1 stands for underweight, 2 is for normal weight, and 3 is for overweight or obese. So accordingly, as per the study tool question or the responses which are there in the question, there has to be appropriate code and at the same time appropriate label. When should we start designing the code? The coding has to be started at the same time when we are designing the study tool. The time when we are designing the questionnaire, at the same time, we should be generating the codes also. How we can do that? That in a hard copy, we write it on the right side of the study tool, or we can use a separate sheet of paper to avoid cluttering. In case of online computer-based tablets, there is a programmed in response wherein each of the response is having a separate code. It goes in the programming in. How we choose the code? In case if there is a dichotomous response of yes and no, our intuition says yes is 1 and no is 0. That kind of response may hold very well when we have yes or no as a response. However, in the studies, many times the responses are not always in yes or no. For example, in case if we are talking about pain, the intensity of pain is graded as no pain, mild pain, moderate, and severe pain. So there are more than 2 categories of response. So the coding is to be done like 0 for no pain, 1 for mild pain, 2 for moderate, and 3 for severe pain. Whatever coding you do, it should be mentioned as a key for a backup. Usually intuitive coding is done for yes or no response. It has minimum of error. Because if we do not do intuitive coding, अगर इंट्यूशन से कोडिंग जो हमारे को लग रही है 0 और 1 की, नो और यस के लिए, अगर हम उसको डिफरेंट रखें, फॉर एग्जांपल यस के लिए मैं 1 कर देता हूँ, नो के लिए 2 कर देता हूँ, कोई बंदा है वो यस के लिए 2 करता है, नो के लिए 1 करता है, इट विल कॉज कंफ्यूजन. सो इंट्यूटिव कोडिंग इज यूजुअली बेटर in case if there are more than 2 categories or the responses are not always yes or no, then coding has to be done and we have to maintain the key of the coding as a backup always. It can be maintained as a separate sheet on Excel. It can be maintained as a separate paper along with the study tool, or in case if the space is there, then on the right hand side of the study tool itself if it's a hard copy. Coming on to the topic of missing data. We have seen the sources of data collection, what all advantages and disadvantages are there. Even if we are doing a new data as per our study, there are chances that we may be having missing data. So instead of leaving that response as blank, it's better to assign a code. For example, if the question is not applicable, then you mention it as multiple times 9, 4 times or 5 times 9, such that we give it a value which cannot be a real response. Okay. For example, if an answer is to be given to a question as yes or no, if the person has not answered it and 9 is mentioned, that means the person hasn't answered this question. If we leave it blank, it means that it could be either the person hasn't answered or the interviewer failed to ask this question to the interviewee. For example, if a height is recorded in centimeters, so if the value is not available, we can write it as 999 centimeter. See, 1999 centimeter, it may not be the possible height because the average height of human being, we know it is around 1.7 meters to say around 2.5 meters. So 999 is a response which cannot be there in reality. So we know that this question was not answered by the interviewee. Interviewer asked the person to give the height, however, the details were not mentioned. In case of computer package, the computer denotes the missing value usually as a dot. So there is different way missing value is mentioned. It is better to keep a code for a missing value because we have to understand when the response is not applicable, when the response was not given, and we have to differentiate it from when the interviewer was not able to ask the question. Taking another example, sometimes the response to a question may be not applicable, such that when you ask a person if he smokes or not, the answer is no. So all the questions which are pertinent to smoking, they become not applicable in that person because at the onset itself, he has answered the first question as no. So to have those responses differently, we can either put it as 888 or a different response, or sometimes we have a structured hard copy questionnaire wherein along with the response a semicolon is put and it is mentioned, if no, jump to question number XYZ, whatever is the following question, jumping over a few questions, so that the time is saved. It is basically a structured performer. In the computer algorithm or in the tab, there are algorithm based schematics which are made initially for the study tool. And once they are finalized, according to the response given by the interviewee, automatically it will direct you to the questions which have to be answered. And automatically the other algorithms, other ARM questions, they become as not applicable. So a coding is already put in. If the performer is structured, it will save time. Okay. In case if the questions were omitted, then data imputation is needed. For example, the interviewer were not able to ask these questions. Maybe some constraint, some other reason, the hard copy, the page was missing, whatever be the reason. How do we respond to that? For that, we have data imputation methods. Data imputation can be done manually, or sometimes if it's a smaller values. If it's a big data, then data imputation may be difficult. For that, we need softwares, or sometimes altogether those values are removed from the study. This has implication onto the study because this appropriate sample size, what we have taken, if it reduces from the minimum sample size, what we have mentioned at the preset, then the study's power or the study's confidence level to capture the reality, it is lost. Coming on to data quality, so that we don't miss everything, so that we don't miss any information which is pertinent or important. Data quality maintenance is very important. It is a critical thing. The monitoring is very important, and it is more so important at the time of study start. Reason being because the interviewer is not trained enough, or he's not in a practice enough so as to ask all the questions in that routine. Moreover, the chances of committing an error are more because it's a new set of questions which is being asked. So we keep multiple checks. Okay, so the checks will help us to correct the problem when it has occurred. If we do not do this, if we do not do quality maintenance, these all errors will turn up at the time of analysis. Then it will be difficult. If the proper quality check is not done, some responses may be missed totally. In case if the person has the patient has moved out of station or the patient has died, then the response will be missed totally. So quality check are very important. Now, how we check for quality? First is we check for completion of forms. So there are a few points that all the pages of the form should be filled out. If not, what was the reason why they were left? Are all the questions completed? If not, again, does the gap which is there truly reflect the unknown data, or some has been accidentally missed? And the writing of the person, is it clear or not? Then we come to the accuracy. Filled है, complete है, सारे pages हैं, सारा data है, कोई omit नहीं हुआ. Then we come to accuracy. Double check कि क्या जो reading ली है, is it correct or not? So most of the readings which take into account physical readings, say weight of the person, height of the person, or blood pressure of the person, usually they are taken multiple times, twice or thrice. So it gives a double check to the sample. Or if there is any critical data, for example, the clinical picture of the person was somehow different and the lab parameter was different. So next time when the person is contacted, we again ask for the same report or the same test report. If the person is brought in the follow-up, we can ask for the previous report also. And we see whether the data was correct or not. Then actions are taken as necessary. Either instructions are given to the interviewer, the retraining of people are done so that all of them are on the same page, or we change the form. If a particular question is not being answered properly, you change the language or the preset of the questions which is being asked, and we check the changes again. Have the changes been implemented? And we document whatever checks have been made, whatever inaccuracies were there, whatever quality control flaws were there, and when the flaws were rectified and quality was achieved. Coming on to the last part, which is data cleaning. Now, once the information has been taken up in the tab, electronic media, or it has been taken up as a hard copy, all the data collected has to be entered in the computer. So the process of checking the data which has been collected and entered into the computer, that process is called as data cleaning. And it takes into account that the data which has been entered onto the computer, it is correct, because error can occur at any time. It can be because of misreport or misinformation, or it could be misrecord, some record which may be missing, or while entering there may have been a typological error. So data cleaning is important. Some errors can be identified by simple checks. For example, we know what the maximum and minimum values of a particular response could be there. So if we put the filter, it will show the outlier result. It will show the outlier, the information which has been entered, it will be get highlighted. For example, if we write about the education which has been completed by the subject, we know it is from class 1st to 12th. Either a person will be illiterate or it will be from class 1st to 12th. In case if the person has written 18, so it is clearly standing out of the range. So we mention it as that this is wrong. So we cross check again. If we have maintained the filing, if we have maintained the tracking ID, we will be able to find out what the actual information was. And if the person's name and phone number is there along with the UID, we see the UID. In case if it is missing in the form, we may be able to contact that person so as to complete that information. Sometimes the errors which are in the same range, they may get omitted during this filter. For them, when we make cross tabulations and we see if there are any inconsistent combinations. For example, the study says that smoking habits in a subject are recorded. But when we have taken the study subjects as smoker and non-smoker, the person is non-smoker, but all the responses of cigarette smoking have been answered by that person. So it is likely that while asking that question, there has been some error. While recording the response, there has been an error. So we may be able to identify by either putting a filter or by cross tabulation. Sometimes the information has to be confirmed double back. Okay, you have to contact the person again in person just so as to complete the information. So the session is open for questions.
Okay, thank you, Dr. Sanjeet. It was a wonderful lecture.
Yes, sir.
And I think a very pertinent topic has been discussed in great detail. So, Dr. Sanjeet, I have a few questions for you.
Yes, sir.
So, you talked about training. So how important is training to the manpower which are involved in filling up the form?
Sir, in case if we are having a large study being conducted or some project which is at a national, subnational level, or maybe some crucial information for which simultaneously we have put in a lot of teams. So it is important that every person who is acting as an interviewer in the field, they should be having knowledge at the same level. They should be aware of that what response of the question is there. Primarily, it is to maintain the accuracy of the information and the consistency of the information, that in case if the same question is asked to the same person by some other person, some second interviewer also asks the same question to the same interviewee, the response is same. It is to maintain the consistency of the questionnaire and to have an accuracy of information so that all manpower which is being trained as an interviewer, they are at the same level, they are at the same page. Minimum errors are done so that no misinterpretation of the question is done.
Okay. And you talked about filling up a forma. So can you describe what is a structured performa, what is an unstructured performa, a little bit of detail on that?
Yes, sir. Sir, when we talk about structured performa, it is exactly like a computer algorithm. Response to question number one leads us to response to question number two. For example, the question number two has two two responses, like yes or no. In case if the response is yes, then a separate set of questions is there. In case if a response no is there, then a separate set of question is there. Once those subset of questions are completed, then again to the common questions the person may go. So it is like a computer algorithm, wherein particular selection of a response channels the information to be collected from a particular subset of questions, omitting simultaneously another subset which otherwise stands as not applicable. This will save the time. Whereas the unstructured questionnaires, in them, there is no algorithm. Only the question is asked and the response is made. So, irrespective of whether the person is eligible for those questions, the questions are fired upon him. Just a common example, if we are asking about smoking and pregnancy outcomes and smoking and health related issues in population will have male as well as female subjects. So in case if it is unstructured, we will be asking the female subject questions to the males, which may not be pertinent to them, or male aspect questions to the females, which may be not pertinent to them. So the interviewee will feel that the responses or the questions asked are irrelevant. At the same time, interviewer will also feel the same. The time which is put in, that is also could be utilized for some other activity. So the time which gets wasted in this, that can be minimized. That can be minimized by having structured questionnaire. In tab, it is easy. In tab, there are already schematics into play, which are based on algorithms, which give a directionality. Whereas in the hard copy, it is better to write in case if there is a no response, go to question number 32. In case if there is yes response, then follow this subset of questions. So this will help us in saving time and at the same time omitting the questions which otherwise are not applicable because of omission of a particular response, and which will help in the data collected which is actually relevant for that particular study
Okay.
subject or the study participant.
So thank you, Dr. Sanjeet, for a splendid talk. And just to add in the end that this is a very important aspect. Unless and until you handle your data properly, whatever hard work goes in your research can actually go a waste. So proper data handling, storage, and cleaning can actually help the statistician who is going to analyze to a greater aspect and to quench whatever was your query when this search was started. So thank you, Dr. Sanjeet.
Thank you, sir.